Hello, everybody, and welcome to this webinar looking at Agents of Change, the story of the Nursing Now campaign. I'm really delighted to welcome you on behalf of the All-Parliamentary group that has looked originally at global health. I am the vice chair of that group, and also very, very involved as the Nursing Now alternate chair. I just want to say a very brief introduction with regard to Nursing Now, and then I will hand over to our speakers one by one. My role this morning is to keep us to time and to try and ensure that we have sufficient space at the end of the session for people to ask some questions. We're hoping to have up to 400 people join this webinar, and so I particularly ask everybody to mute themselves and to use the chat room as and when appropriate. Nursing Now came about as a result of the APPG on global health in the UK, looking at the needs for healthcare professionals in the future, and in particular in relation to nursing. And we published a report called Triple Impact, which argued that investment in the nursing and midwifery professions would result in increased access to universal healthcare for all. And so our work has always been closely linked to the SDGs and the need to try and ensure that everybody on the globe, irrespective of their financial state, has access to first-level healthcare. We argue that nurses are extremely effective at delivering healthcare, both in healthcare prevention and obviously in relation to public health promotion, whether that is teaching people about how to manage clean water, to prevent the spread of airborne infection that has been so dramatically shown with the current pandemic, and also to look at how to maintain a healthy lifestyle to try and prevent disease. Nurses also have a really core role in delivering healthcare in both the mental health and learning disability domain, as well as the acute hospital sector. We very much hope that you will enjoy hearing about the success of the work that has been led by so many over the last 3 years, particularly by Nigel Crisp and Sheila Tao, our chairs, and by Barbara Stillwell, who has been our chief executive. And at the beginning, we had Catherine Henaway as an acting chief executive, who also took a significant role. The results of Nursing Now are here for you to see, but of course, the results will go on for decades to come, and we hope that nursing will be seen as an increasingly attractive profession across the globe and open not only to women, but to men. It still remains one of the very few professions that has less men than women in it, and yet the ratio of men to women globally is 1-to-1. So we probably need to look at how we can recruit more males into nursing. And I'm delighted that we have somebody speaking about that later, one of our speakers, Manesh, who is a young nurse from Zimbabwe. I now want to hand over to Professor Sheila Tao, who's the co-chair of Nursing Now and the previous Minister of Health for Botswana, who is going to talk about what the campaign has done for us globally. Sheila, welcome.
Thank you very much, Baroness Mary. Let me greet everybody and just say good morning, good afternoon, good evening, and it's really great to be here. The first thing I want to say is to encourage our nurses and other health professionals to read this report, because it is truly a very great story. It cannot be told just, in book alone, but even words, so that this is what we are doing right now, to be able to tell the story of the Nursing Now campaign. For me, I'm going to be looking at the global impact. And as Baroness Mary Watkins has said, you know, the messages were very simple and non-controversial at all. The idea was that we want to improve universal health coverage by raising the profile and status of nursing and midwifery. And indeed, it was sold throughout the world. It was something that could resonate with a lot of countries and you know, a lot of even non-health professionals. So let me simply say that this well-coordinated campaign had the following global impacts. The first was really the unity of purpose. There was, we've seen great unity among nurses and midwives. And indeed, the collaboration and the launching of the Nursing Now campaign in the various countries was a great success. You know, when you read it doesn't really quite tell that intrinsic lived experience of what a lot of people went through. For example, if you look at any one country, let's say Portugal, where they were waiting for me to come and, you know, support them in their launch. I mean, that you could just tell the excitement of having a visitor from outside. And indeed, all the members of the board, we were able to go to the various countries and be with them to support them in the launch. And just that brought that unity of purpose that you cannot even be able to measure, you know, in a book. So it's really, that was really great. So it brought nurses together to not just focus on their own countries, but to collaborate more. And we have seen regional nursing networks actually start to brighten up and become alive. For example, the Hexacon, East Southern and Central College of Nursing. So it's really great. And indeed, the Nightingale Challenge, we were really saying, let's invest on the future of nursing and midwifery. It was a simple message, but of course to employers, some of whom are not non-health professionals. So we saw employers doing that. And indeed, we even got more of the younger people than we expected being brought about and getting into leadership development in their respective areas. Now, the second value or success was really the joint coordinated advocacy. And that too is a process that is not quite in the book, you know, in the report when you read it. But every one of our board members was able to do advocacy, first with the Director General of WHO, and then with the members of the executive board of the World Health Assembly to ensure that, you know, the 2020 becomes declared the year of the nurse and the midwife. This became a great success. And of course, all we saw was that, oh yeah, the World Health Assembly has declared 2020 as the year of the nurse and the midwife. But the nitty-gritty, the process that went in there was very intense. And it brought us board members together to the point where I don't think we'll ever let go of each other again. We may be coming to an end, but hell, we've gone through so much together that I think we will remain friends and colleagues and really collaborators forever. So it was a success in that it was therefore that once in a generation opportunity for nurses and midwives to, you know, to be at the center of the global and national health policies. And we're able to celebrate nurses and, you know, it did a lot to improve nursing and communities in the world. The influence of that was that because of that declaration, it changed the minds of politicians and nursing leaders to actually now, you know, see nursing as that profession that needs to be high up there. And we saw the advent of even more chief nursing officer positions. Now we have a lot to say about that one because, okay, they have been formed. But I'm seeing that in the process, in the future, we are going to have to be advocating to say it should not be just one person with maybe one support staff. It should be a whole office, and it should be at the director level with more you know, power in terms of decision making. So, but at least we now have seen more countries having that position. and we can only therefore advocate to improve that position. Now, the other success was really the value of decision making. I think it has shown nurses that evidence is really important. Leaders have to have evidence-informed decision making. And what then happened was, together with International Council of Nurses and WHO, we worked with countries and to produce the State of the World Nursing Report. And in April 2020, ICN, WHO, and we released that State of the World Nursing Report, which was really the first of its kind. And it described the critical role that nurses and for nurses and midwives in achieving universal health coverage and the sustainable development goals. So that it made it very clear that government needs to invest in nursing and midwifery in order to achieve SDG 3, as you know, that SDG of health and well-being. In fact, as well as the other SDGs, such as gender equality and economic development. So we know that events marking the year of the nurse and midwife were disrupted. And indeed, a lot of suffering has occurred, but it also showed nurses that compassionate and caring force that can care for humanity in all health settings. So let me simply conclude by saying that our work is not finished. We have only just begun. With what we have done, we are now want to see at country level more nurse-led clinics and with midwife full potential. And we want more specialist nurses and the development of more midwife services with collaboration at country level, at regional level, and collaboration especially at global level, so that we can actually train and educate more nurses to fill this very wide shortage that is still apparent. We want more nurses being central to primary health care and more nurses and midwives in health promotion and the disease prevention. Now, I believe, based on my lived experience, that in the same manner as with HIV and AIDS, we will not have those achievements if we do not engage nurses and midwives as decision makers. So thank you very much.
Thank you very much for that really inspiring speech, Sheila. Not that we would expect anything less from you. The reminder that, of course, the development of nursing as a profession also enhances other SDGs, as you've talked about, particularly in relation to gender and economic activity, is one that we really need to hold on to. I'm now going to move to our next speaker, Munash Nyaka, who has been on the board as one of our younger nurses throughout. Welcome, Munash, and look forward to hearing why nursing now has been so important for young nurses.
Thank you so much, Mary. And it really is amazing to be able to be here this morning as part of the launch of the report for Nursing Now. And really in sharing about the impact that Nursing Now has had for young nurses, I personally can actually be able to look into myself and the growth I have experienced as being a young nurse, part of the campaign and also as part of the board. Being a young nurse as part of the campaign has really provided me with an amazing opportunity to be part of decisions as part of the board and be able to share opinion of young nurses towards the campaign. Through this, it has really taught me a lot in terms of what goes into global health decision making, what goes into being a leader, what it means to be able to stand up and also be able to have a voice as a young nurse. And this story of mine is not a story that is unique to me, but it's a story that is unique to young nurses across the world. That through the campaign, young nurses have been able to stand up and be able to share their voices and be able to raise their opinions and be able to be part of the global campaign in sharing what they feel is necessary towards improving health globally. So the campaign has really been an amazing opportunity for young nurses. We have had young nurses that were part of the World Health Assembly that was held in 2019. And that was an amazing opportunity, being able to see young nurses at the forefront of such an amazing platform and being involved in such an amazing event. And through particularly the Nightingale Challenge, young nurses have been able to develop leadership skills and be able to share amongst themselves in being able to highlight how their experiences with being an early career nurse, and also particularly at this time with the COVID-19 pandemic, some of their experiences that they have had in responding to the pandemic. It has really been amazing to see the energy young nurses have shared across the world towards the campaign, and being able to ensure that this energy continues and it doesn't end now, but it's energy that will be there as even as the campaign does end and moves forward. So it really has been an amazing opportunity being a young nurse as part of the board and part of the campaign, and looking forward to the next phase and the next stage of the campaign.
Thank you very, very much, Manash. And you've really highlighted the importance of the Nightingale Challenge that has given opportunity to young nurses. And I want to take this time just to thank Burdett Trust for the extra funds that they have put in to make sure that the Nightingale Challenge continues and will be the Nursing Now Challenge. I see that both Shirley Baines, who's helped ensure the funding goes on, and Lisa Bayliss-Pratt are on this webinar. And so we really want to thank both of them for the work they've done together, and Christine Beasley, who is leading as the ex-chief nurse for England on the Nightingale Challenge on behalf of the Burdett Trust. And what's great is the Nightingale Challenge will now be called the Nursing Now Challenge. So that gives a clear segue into the future. So thank you. We will be coming back for questions later, but that was really great to hear from you, Manash. I now move to the next speaker, who is Barbara Stillwell, the Executive Director of Nursing Now, who's going to talk about our legacy for Nursing Now globally. Over to you, Barbara.
Thank you so much, Mary, and greetings to all of you wherever you're joining us from. I see colleagues in the USA for whom it must be terribly early, and colleagues also from Myanmar. You're especially welcome. I'm sure it's not easy to join at the moment. So welcome to all of you. Warm greetings. I am the Executive Director of Nursing Now, and I am very proud to have been what I think of, and I'm sure is, the team leader for Nursing Now for the last 3.5 years, for it has been a team effort every step of the way. The board, as Sheila mentioned, our champions, our ambassador, our patron, and especially our core team, we've all had to work together to create strong networks around the world and to advocate for the goals of the Nursing Now campaign. And I hope that you will see this reflected in the report, in the many activities, in the successes that we've had. It could not possibly have been done without the whole team pulling together and everybody speaking together. What we've seen is the strength and the creativity that comes from power together. When we find our voices to speak up for the profession and for those that we care for. And when we find our voices, that's when we can become the creative profession that we all know we are, but often, certainly in the past, we have been overlooked and not noticed. But I think what Nursing Now has done is given opportunities for nurses working together to become their own advocates and to become champions for change and to become change agents, working through the Nursing Now groups and through the Nightingale Challenge. So we hope, the team that's worked on this report, we all hope, led by Aisha Holloway in Edinburgh, we hope very much that the report does justice to what we've all achieved together, and especially to what all of you out there have achieved in the groups, in the Nightingale Challenge, even through the most appalling pandemic. So what will endure? What is the legacy of Nursing Now? For each of us, the legacy will be different because the story of Nursing Now is not one story, but it's many stories, each of them shaped in a different way, depending on where your story has taken root and flourished and grown. But I do believe that Nursing Now, wherever it's flourished, wherever it's grown, has left footprints. And that's why we called our final event Global Footprints. It's left footprints. And I believe those footprints will remain. So what I'm going to just do very briefly is give you my take on the legacy, which may be different from yours and probably will be. And I think that's fine. I think all of us will have our own story to tell about Nursing Now. There are three things that I want to share with you. The first is about the Nursing Now groups. Those groups very quickly formed. When I joined the campaign in July 2018, I think there was something like 20 groups. By December, there were more than 300. December of 2018. And now, as we close the campaign, there's over 700 groups around the world. And they're important because they became a critical network for sharing ideas, for sharing innovation, and as Sheila's also said, for sharing evidence. And once we were forced to connect virtually in 2020, I would argue that we became even more global, because every event we had, we could invite everybody to join. It wasn't selective to a country or even a region. And what the groups were, I strongly believe, was a convening platform. They were able, and we indeed required them, to bring together diverse groups across countries. The chief nurse, the educationalists, the professional associations, and non-nurses and young nurses. And that was critical because it allowed people to begin to share in some places in new ways. And when the groups were launched, as Sheila said, we were often invited to go to group launches. And that again raised the profile. Having Sheila Clow come and visit you, was a big deal. And Baroness Mary Wilkins too, and Lord Nigel Crisp and Annette Kennedy from ICN, and often all of us together. We were a big crowd, and we actually made the Minister of Health sometimes notice nurses. And that's critically important for nursing in that country. The groups are now being nurtured within ICN, who've been our very influential, important, and empathetic partners in our work. And I really hope that the strength of this network will continue to grow under the sort of nurturing umbrella of ICN and continue to be a network for joint learning and for action. And more of that in a moment. The Nursing Now groups don't have to disappear. And the work that you have all started out there does not have to stop. This is a powerful network of allies. And I believe that this is a legacy. I believe this will endure, and I certainly hope so. The second point is really all about Menashe and his colleagues. From the beginning of nursing now, young nurses have been involved, and valuing them and having a focus on them was a core value of the campaign from its very get-go. And Catherine Hanaway was one of the people who really fought for that, and much respect, Catherine, that really endured throughout the campaign. We've seen this work grow into the Nightingale Challenge in 2019. And as Mary has already said, as you know, the Nightingale Challenge will continue as the Nursing Now Challenge, funded by the Burdett Trust for Nurses, with Lisa Bayliss-Pratt remaining at the helm. This is a huge legacy. We already have over 30,000 nurses as part of the challenge, and it will grow. I'm sure it will grow over the next 2 years, and it will be a real powerhouse. I am very optimistic about the future, and I'm optimistic because I see that young people are different from the way that I was as a young nurse. Thank goodness. In young people, there's an exciting future. Their attitudes are different, their expectations are different, and they will speak out for nursing in ways that I never did. And I'm so delighted about that, Menashe. It's been such a privilege to know you. Menashe and I wrote a chapter together for a book that was published last year, and it was very exciting to work with Menashe, to hear his views on what the future looks like on nursing as a young nurse. And so many other young nurses around the world have continued to inspire me. I should confess at this point that I have a granddaughter who is a nurse as well. And I'm terribly proud of her. She is absolutely wonderful and smart, and watch out world, these young nurses are coming, and thank goodness for that. The third thing is that I want to talk about, again, has been mentioned. We were very fortunate to have WHO as our partner in this campaign. As Sheila mentioned, we lobbied with them, we advocated for all kinds of things, and Dr. Tedros has been a marvelous leader partner, as has Elizabeth Ero, Kerry McCarthy. We've just benefited so much from their partnership, from their input, from their expertise. And we have been able to help our young nurses enter into dialogue with the WHO, talking about strategic directions on nursing midwifery, talking about state of the world's nursing. They've helped to shape the strategic directions, as our groups did, in collecting data. And they are now going to be discussed at the upcoming World Health Assembly. We gave our young nurses the opportunity to go and see why the World Health Assembly is so important. So the fact that the strategic directions for nursing and midwifery are coming up in later this month, this is a beginning for global nursing, even as the campaign is ending. And our legacy, I do believe, will be seen in nurses who are making sure around the world that the data on nursing is available, that it's accurate, that it's collected, that it's analysed, and that it's used. And I don't think in years gone by that nurses have been nearly as aware of the importance of data as they are now. And I believe that Nursing Now has done a lot to promote the importance and the use of data for nursing everywhere. And I do so hope that that will go on, and that we will all see that it's our job to make sure that data is there and that it's used, and that we are working together with WHO to make sure the recommendations in the strategic directions are implemented and don't sit on a shelf, as indeed we hope the recommendations in our report, which you're going to be glued to later on today, are also going to be implemented. In the last 3 years, we've really glimpsed the power of nurses everywhere to improve health. The campaign has been a beginning. And I do believe that the powerful voice of nurses will continue to be heard as we rebuild strong health systems. Nurses are indeed essential agents of change. And as our report says, that should give us all hope for the future. Thank you, Mary.
Thank you very much, Barbara. A real challenge for all of us for the future to ensure that the data is available to inform the best development, not only of the profession, but of healthcare globally. That was a really rousing reminder of really important issues. I now introduce our last speaker, Lord Nigel Crisp, who really has been the driving force behind the beginning of Nursing Now and ensured that the resources have been available for us to do our work. It's my real pleasure to invite Nigel to talk about Nursing Now and the implications for health systems. Nigel.
Well, thank you very much indeed, Mary, and great to have a chance to speak on this. I'd like to share my screen, so I'm going to try and do that if colleagues will allow me to do so. And where is it? Here we are. And from the beginning. Good. I think that's probably got me there. Mary, you know, it was 4 years ago in January when we sat down in a coffee shop, as it were, in Parliament, and discussing our report on the triple impact of nursing, and feeling that it was being ignored by everyone else other than nurses. So we thought, why don't we try and start a campaign? And it just sort of blossomed from there. And 4 years later, here we are, which is extraordinary. And let me pay tribute to everyone who's been involved in that, to board members, including the people on this call, my wonderful co-chair, Sheila Chalao, who we've already heard from, Mary Watkins, yourself, you're our alternate chair. And I noticed in the screen, and forgive me if I've missed anyone, but we've got Adelaide from Spain, Adelaide Zabigui, sorry, even after 4 years, I can't pronounce your name, Adelaide. Maureen Bisignano from the US, Rosemary Josie from the Bahamas, and Roeda Almeida from Jordan. So just a representative of that fantastic board, and Monashi, of course, who's also here. Let me also pay tribute to Barbara and to all our staff during the course of this programme. Let me mention particularly Catherine Irwin and Hannah Finch, who are here and have been facilitating this, and so many other webinars and events, and have got that marathon to come next Monday with those conferences that take us around the world. And let me also just mention Yvonne Wiesa, who I see, a former member of staff who has joined this call. I'm assuming it's the same Yvonne Wiesa, good to see you. But let me also just mention the Burdett Trust, which we've already said, who've enabled this. They provided the funding, the largest part of the funding, and supported it. And Shirley Baines and Chris Beasley in particular have been really great supporters, as have ICN and the WHO, as has been said. And I'm delighted to see great allies again on this call from the European Federation of Nurses and from Sigma, and I'm sure from other organizations, C3 and C2 rather, and others. So, but really our tribute should be to nurses all around the world, nurses and their allies everywhere, who for so many exciting moments, as Barbara's already said, this is not just one story, this is a lot of different stories in, what is it, 126 countries we're now got Nursing Now groups in, extraordinary range of activity. And let me, of course, also pay tribute to what nurses and others are doing during this pandemic. Our thoughts at the moment, of course, are particularly with India, and I see we've got colleagues from India here, and our fears are with Africa and, you know, potentially what may end up happening there. Barbara's already talked about the legacy, and I absolutely agree with everything that she said there. And I suspect when people come to evaluate this campaign in 5 years' time, or 10 years' time, or 20 years' time, actually the bit that people will pick up on most is that there will be the leaders of nursing then who will say things like, I got my chance during the Nightingale Challenge or something like that. You know, I think there will be a real impact of people, because healthcare, of course, and health is about people, and nurses are absolutely central to everything that happens. So let me just talk then briefly about the implications for health systems, as my title suggests that I should be doing. And when we set out with this, Mary and I and then others, I had come to the realization, which I think Mary already knew, that one of the biggest things we could do to improve health globally was to strengthen and develop and empower nurses. And that's what it's been about, improving health through developing, supporting, promoting, raising the profile and status of nurses. And I'm even clearer about that now. And it's also always been about not nurses versus doctors or versus anybody else. This is a team game. Health is a team activity. And we do know that strengthening nursing will strengthen the entire health team and the entire health system, and really important that we think in those terms. And that within that, nurses can be real agents of change, helping make things happen, not just doing the day job, but making change happen for the future. So let me just spell out where I think that might be. I believe that nursing will become even more important in the future than it is now. And there are a number of drivers for that. The first one is disease, epidemiology. Leaving aside, if I dare for the moment, leaving aside infectious diseases, although of course infectious diseases nurses have a vital role in. But as epidemiology is changing and we're seeing more long-term conditions, more NCDs or chronic diseases or whatever language one wants to use, it's very clear that this is a whole area of continuing long-term care and attention and working with people and walking alongside your patients. That this is an area where nurses will play an increasing role. I also think that people have understood, partly again accelerated by COVID, that health is not just a biological thing or even a biological and psychological thing. It's a biological, psychological and social and indeed environmental thing, that actually how we live our lives, what impacts on us, the social determinants and so on, are really vital. And nurses, of course, start life with a much more holistic view of in their training and their education than the bio-psycho sort of model. So I think, you know, we're moving in that direction and nurses are already there. I think when you talk about value and quality, I think people almost automatically start to talk about quality. They start to talk about nurses in particular, but I think this is also going to be true of value. I think increasingly we're going to see that, you know, why in some countries have we still got a 1-to-1 ratio between nurses and doctors? Why are we investing so many more money in doctors than in nurses? And I think there are value arguments about why you should invest in nursing. Importantly, and you know, 30 years ago, I wouldn't have said this, there's a track record and there's evidence. Now we can talk with confidence about nurse practitioners. We can talk with confidence, as Sheila did right at the beginning, about consultant nurses and specialist nurses. We can talk with confidence about the evidence that's out there, collected by people on this call and pioneers. Indeed, Barbara was one of them in the UK around the nurse practitioner movement. So there's a track record and evidence that wasn't here 30 years ago, maybe even 10 years ago. Another important point is the changing status of women. I have observed as a layperson and a man that, you know, the status of nurses in many countries is very closely linked to the status of women. And we need to see improvements in both of those areas. And then finally, actually, I think COVID has accelerated this. I think it's really shown the increased, shown to the world the role that nurses play in everything from the community to the most intensive of intensive care settings. And I know in my country, in our country here in the UK, we've actually seen during this period a great range of great increase in people wanting to become nurses, become other health workers as well. So there's been a real evidence of that happening, which is, I think, enormously encouraging. So if that's the changing world, what does it actually mean in practice? What would this actually mean? Well, it will mean the obvious things that we know about. Many more nurse-led clinics, particularly for non-communicable diseases. And we've got a lot of those already in the UK, but more to come. More specialist nurses, more nurse practitioners. I think primary and community care will be very much a nurse domain. In reality, it often is at the moment in low and middle income countries. But I can see the sort of model developing where you've got community workers or others right out in the most rural areas, paid preferably, but also no doubt linked with voluntary activity, where you've got nurses in the primary care centres, and you've got a lot more doctors and specialists, perhaps, including specialist nurses in the hospitals. And I think over the next 20 years, we're going to see that model really develop and really become paramount. And I think we're starting to see it in the UK, where we are starting to see more nurses involved in primary care. And I think that process is going to continue. And then the big one that we so often neglect, which is public health. And this takes us, of course, into the social aspects of health. Remember the WHO definition of health being about physical, mental, and social well-being. And I think there's a whole range of issues here around mental and social well-being and public health that I think nurses, as part of the community, are very well placed to tackle. And I think that takes us on into something I'm particularly interested in at the moment, is health creation and tackling or dealing with the causes of health and not just tackling the causes of ill health. So I think there's an enormous amount to come. And as we look forward, what does this mean for global health? Well, I think this will enable us to strengthen health systems, to tackle infectious diseases, NCDs and climate change, which need to be tackled together. We need a holistic, clear, wide view of how we do that. I think it will allow us to think in terms of prevention, protection, and health creation. And let me finish with the point that the last year was the year of the nurse and the midwife. Well, this year is the WHO International Year of Health and Care Workers. And I do like their slogan, which is protect. People have been having a very tough time. Protect, invest, and do it together. And I think part of the message of Nursing Now is togetherness. Togetherness across the generations, which we've talked a bit about here, togetherness across the professions, and nurses working together and making sure that your specialisms and so on, you still come together around something like Nursing Now, and you take that forward into the future. So like Barbara, I am optimistic about the future. I think there's a platform to build on here, and I think there's great people to take it forward. And I look forward to hearing about it from the sidelines in the future. Thank you very much.
Thank you very much, Lord Chris. That was a really good summary of what we need to do next, and reminding us that that power is in our hands as nurses. We now have a short period of about 10 minutes for questions and some answers. Now, at the moment, I've been on the question and answer chat, and the first question that comes up is for Manash, which is, what is your top tip, Manash, for early career nurses to become champions for change? Manash, do you think you can take that, your top tips?
Yes, sure. Thank you so much, Mary. And I think my top tip for young nurses is be bold, be brave, and don't be afraid to raise your voice and be able to share your opinions. I think as young nurses, it's really been amazing to be able to see young nurses develop in confidence, in being able to share their views and share their opinions. And that takes a lot of bravery. So young nurses should not be afraid to be bold and be brave in contributing towards the future.
Thank you very much, Manash. Now, at the moment in the question box, I've got an invitation to any of us to go to Pakistan to see nursing there. So please remember that one of the things you can do through the Nursing Now legacy network of Nursing Now groups is to make yourself known if you're traveling to another country, and to say, I'd really like to come and spend a morning or afternoon with you to learn about nursing and the developments in your country. There are no more actual questions on the question and answer chat. There are some statements, but I can see Nigel's got his hand up. So Nigel.
Mary, I think
And
on
Sheila.
the participants list, you've got Adela and Wazim have both put their hands up. I don't know if they've intended to, in which case they probably want to ask questions.
Thank you very much, because trying to keep on both is, so can I therefore take, first of all, did you say
Sheila.
Naseem? I'm just opening the other box. Sorry, Nigel, you've muted yourself.
It's in the participants file. If you go there, you'll find 3 people with their hands up now.
Right.
If you go into participants.
Thank you very much indeed. So we're using all the systems.
Yeah.
So the first hand that I can see up, Nigel, I'm just going to let you say their name and we'll take them while I find the others.
Okay, well, this is the first name I can see is, and it's gone, Adelaide has stopped. Well, the first name I can see at the moment is Wazim Ahmad Khan. And I don't know if Wazim, who I think is from Pakistan, would like to ask a question.
Thank you.
Can we unmute him? I don't know how that's done.
Wazim?
I think he's unmuted. Oh no, he's remuted.
Hello.
Wazim, you're unmuted. Yes, we can hear you.
Okay.
Welcome, Wazim.
Hello from Pakistan.
Delighted to hear your question, and then it's Fiona Ross.
Yes, it is a very excellent talk, and all the way it is all the time inspiration for us nurses. Lord Nigel Chris talk, Barbara and Sheila's, they are a leader, real leader. And I put already my question, we need this campaign to extend. And last 3 months, I'm living in Karachi, Pakistan, and doing whatever I can do. And I'm welcoming you everyone to Pakistan whenever you get chance.
Thank you very much, Wazim, and we'll take you up on that. I'm sorry to tell you that we have not got the finances to continue in the way that we have, and we never intended to go beyond this period. But that doesn't stop Nodal networks working well and using the kind of platform we're using today to connect globally. So thank you very much indeed, Wazam. I'm now going to move
Mary, Sheila here.
Sheila, yes.
Yes, I have already actually answered about 3 questions. I typed the answers to the people concerned. One was on primary healthcare, and you know, and shared two emails. I think somebody wanted to connect with Barbara and myself. So Barb, maybe you want to share your email. Yes, thank you.
Thank you very much, Sheila. And I think that's the thing. Some people are doing it in chat and some on the participants list. But I have got Fiona Ross next, who has definitely got her hand up on the participants. Fiona, welcome.
Thank you. Can you hear me?
We can, Fiona.
Yeah, actually it was a mistake, but as I've been unmuted by you, I can't resist saying what an uplifting hour this has been, and to congratulate everybody for everything that you have done in 3 short years. I think it's phenomenal, and you know, from seeing the very early beginnings, you know, I think we should all thank you, and so and that's my thanks.
Well, thank you, Fiona.
You're on
You are
mute,
muted,
Mary.
Mary.
For those who don't know Fiona, I'd just like to thank her for her leadership and development in the UK and internationally. She was one of our first cohort of graduate nurses from Edinburgh University, is a leading and distinguished professor in our country, and has always encouraged young nurses. So great that you've joined our seminar today. The next person is Constance Waterman. Constance, over to you. Constance, have you got a question for us? No?
Constance, you need to unmute your microphone.
Constance, can you unmute? Right, shall we move to the next question, which is Sharina Singh? Sharina, you've got your hand up.
Hello, everybody.
Oh, hello. How lovely to hear you. Welcome.
Thank you. This program is really delightful, and I really enjoyed sharing evidence by connecting virtually. I'm Srijana Singh from Nepal, and I'm an MSN graduate, MSc Nursing graduate. I would like to keep the question to Dr. Barbara. Dr. Barbara, ma'am, is there any avenues to emphasize higher education and research, regarding higher education and research in the South Asian countries like Nepal?
Say it again, Srijana.
I would like to keep the question that is there any program from Nursing Now in the South Asian countries like Nepal, where we nurses don't get chance for higher education? Is there any program from Nursing Now regarding higher emphasis, to give the emphasis regarding higher education and research in South Asian and underdeveloped countries like Nepal?
Thanks, Srijana. I got it now. I didn't quite catch it the first time. So Nursing Now has not been a technical program, so we haven't actually put on any courses. What we've done is shared courses and shared information. And so what I suggest, Srijana, is that we try to get you linked in with the Nursing Now Challenge now, so that you can find out what's going on in your area. So I wonder if you would like to have my email address. If I put it in the chat, would that be helpful? And we can correspond, and I can link you in to the Nursing Now Challenge. Would that be useful?
Sure, ma'am. Sure,
Okay.
ma'am. Very much useful, ma'am. In our country like Nepal, higher education and research is still underprivileged, ma'am. Being a master in nursing also, we don't get right opportunity to work, to become educator. So Nursing Now is the most useful platform for Nursing Now is a emphatic, powerful network for nurses like us. So thank you very much, core team of the Nursing Now, and I'm very much grateful to become a part of this webinar. Thank you very much.
Well, thank you for joining us, and we're absolutely delighted that you've managed to do so. And we have had a fantastic webinar previously this year involving some work on palliative care in your area. So thank you, and we look forward to ensuring that you can be linked virtually to other Nursing Now groups and interests as we stop from the centre and enable people to work through their own networks. But it'd be great that you'll be in contact with Barbara. Barbara, you had one more thing you wanted to say?
I just wanted to say to Srijana, do look in the chat, because Jaya Mental Health has also reached out. They've been working with us again on some initiatives in Nepal. So I can see already there's a little network, and that's, you know, the big strength of Nursing Now. There's networks that you can link into. So please do, Srijana.
Thank you, Dr. Barbara. Thank you very much. It is very grateful for me. And I would like to thank core team of the Nursing Now, from entire team of this nurses. Thank you, Nursing Now. Thank you very much.
Thank you.
Thank you once again.
Thank you very much. Now, I can see no other hands up in the question and answer. So I suggest that I just ask Sheila and then Nigel if they have anything they want to add, and then I'll close the session for today. Sheila. Sheila, you're muted. Great.
Thank you very much. Not much, except to thank everybody who has participated and the questions that have been asked, and to say, as we said, this has been the beginning, but you know, we're going on as the Nursing Now Challenge. So please be engaged. But join us next week on the 24th, as we now celebrate the global footprints of nursing. So go to the website and be able to join in so that we can all really be able to be happy and to celebrate everything about nursing and midwifery. Thank you very much.
Thank you, Sheila. And Lord Crisp, Nigel.
Mary, thank you for that, and absolutely agree with what Sheila just said, as always. And it's been a great pleasure to work with so many people on this great campaign. One point I think I'll just draw attention to is the title of our report, Agents of Change. You can actually see when you look at the report that there's a reference to where that came from, which was about the education and the future role of professionals. And this notion of agents of change. So you're not just doing your day job, if I can put it like this. And if Maureen's still on the call, she'll know that IHI have always called for people saying health professionals should have two jobs, their day job and making improvements. And it's the same sort of point, that actually nurses are very well positioned to be the agents of change who move things on at the most local level, you know, shifting the way the service is actually delivered, shifting the way the system starts to change and so on. And I think it links with Manash's point about whatever it was you said at the end about being bold, be confident, you know, have a go, you know, better to act than to regret not acting. That's where I think I would want to leave it with people thinking of themselves, and nurses in particular, because of your pivotal role in healthcare, because you're in health, not just healthcare, you're everywhere. That actually you can be real agents of change, making things happen in your local services, in your countries, and ultimately in the world. So thank you all very much.
Thank you. And I just want to thank everybody who's joined us today, everybody who's worked so tirelessly to get this session organised, to produce the report, which, as Barbara, our Chief Executive, has just said, or Director has just said, we should all be glued to the report. And I do recommend that if people are joining on Monday, and the more the merrier, that you've at least glanced at the executive summary of the report, which I think is a really exciting piece of work. And there are no better words than those of Manash for us to end this particular webinar. And I believe he said, be bold, be brave, don't be afraid. Thank you very much for your time this morning, this evening, or whatever time it is in your part of the world. Goodbye for now.